Hello everyone, I'm Dr. Sandy Balwan from Northwell Direct, here today with Dr. Nina Vincoff, our Chief of Breast Imaging at Northwell Health, and we're here to talk to you today about breast cancer. Dr. Vincoff, welcome and thank you for joining us.
Thank you so much for having me.
So first question, Dr. Vincoff, what are some risk factors for breast cancer?
You know, I think it's important for women to know that everyone is at risk for breast cancer. The average woman has a risk of 1 in 8 in her lifetime for developing breast cancer. But there are some things that will increase your risk. First and foremost, family history. So it's important to know whether anyone in your family has had breast cancer, but also other cancers like ovarian cancer. It's obviously important if you or anyone in your family has tested positive for the genes that we know are associated with breast cancer. And then there's other things. Ethnicity is important. You know, we know that some ethnic groups are at increased risk for breast cancer, in particular Black women, Ashkenazi Jewish women. Breast density is really important. So women who have dense breasts are going to be at increased risk compared to women who don't. And then there's other things in your personal medical history that can play a role. Things like the age of your first menstrual period, the age you went through menopause, whether you were pregnant, how many times and at what age, whether you breastfed, all those things can play a role. And then there's the lifestyle risk factors. There's things like having a healthy diet, exercise, not smoking, alcohol use.
When should women start screening for breast cancer?
The best recommendations for the average risk woman is to start screening for breast cancer at the age of 40 and to have a mammogram every year after that. Those are the guidelines that are going to reduce your risk of dying from breast cancer the most, actually by up to about 40%.
So we know that mammograms are one way of screening for breast cancer and MRIs also.
So we have a lot of different kinds of tests for looking at the breasts. Mammography is the test that we recommend for everyone. It's a quick and easy test. It uses low-dose x-rays to take a picture of the breasts. But we know that it's not perfect, particularly, as you mentioned, in women with dense breasts. Mammography can sometimes miss cancers. And so that's where ultrasound plays a role. So ultrasound, instead of using x-ray, uses sound waves to look at the breast. And it can be very helpful for women who have dense breast tissue. And then you mentioned MRI. So MRI uses magnetic waves actually in combination with IV dye. And those two things in combination can be very, very sensitive for finding breast cancers. So MRI is not a test for everyone. For people who are at high risk, MRI can be very helpful. There are a number of different ways to schedule an appointment for mammography. Is to go to northwell.edu/mammogram. And there you can actually find all of our locations where we offer mammography, and you can schedule your mammogram yourself online. Or you can, of course, always call the radiology call center, and they can give you information about where we perform mammograms and help you schedule an appointment.
You mentioned risk factors for breast cancer. What can women do? A lot of times women feel very powerless in this. So are there things that we can do to reduce our risk of getting breast cancer?
So it's interesting, you know, there's nothing that you can do to prevent yourself from getting breast cancer. There are things that you can do to reduce your risk. We mentioned some of the lifestyle things, especially diet, having a healthy diet, not smoking, reducing your alcohol intake, exercising regularly. But the most important thing that women can do is having a mammogram. You know, by finding cancers early, we're able to identify them before they become a bigger problem, when they still have the best chance of cure. And even for cancers that need to be treated, we're able to find them at times where your chances of needing aggressive treatment, like mastectomy and chemotherapy, are reduced when we find your cancer early. So I always feel like instead of being scary, that should feel empowering. You know, by having your mammogram, you're doing something to really be proactive about your health. And that should make you feel powerful, not afraid.
It's funny, I'm an internist, as you know, so I have a lot of women who think when they get the diagnosis, they say, but I've been going for my mammogram every year, almost thinking that it should prevent them from getting them. And we have to remind each other that the purpose of this test is to find it. Where if you have it, like as you said, we can intervene early and make sure that you have the best chance of a successful outcome. With the least, you know, the less invasive it is, the easier to treat, and the less of a problem and a condition for you.
Absolutely true. And I run into women who say that all the time as well. And then I remind them, you come every year so that we're going to find cancer when it's as small and early as possible. You're doing the right thing.
And reinforcing that is so important. So what are the symptoms of breast cancer?
Well, I think it's really important to understand that most breast cancers that we find on mammography don't have any symptoms, right? That's actually the point of early detection, is to find cancers before they have symptoms. But some women are going to develop symptoms in between one mammogram to the next. And so the things that you want to be thinking about are a new lump in the breast, a new pain in one part of the breast that doesn't go away with your cycle, a new discharge, especially if it's bloody or clear, and then just an overall change in the appearance of the breast, the skin, the nipple. Any of that could be important.
And particularly rashes, right, on the breasts, if something's not going away.
Absolutely. Anything involving the skin or the breast is something that you should call to your doctor's attention.
Well, Dr. Vincoff, this has been really informative. So we'd like to leave you with a couple of messages. Breast cancer is common. The best thing you can do for yourself and for your loved ones is to get a mammogram every year. And of course, we're here to help you. If you do have the unfortunate situation where you have breast cancer, we're here to help, and it's not doom and gloom. It's actually quite treatable. Dr. Vincoff, thank you so much for joining us today. And if you have any questions regarding breast cancer and screening and early detection, please call Northwell Direct. Thank you so much.